All right. Good morning, everyone. Thanks for tuning in and joining us here on our weekly update with myself, Rainey, the proud mayor of the city of Peekskill, joined by our wonderful city manager, Andy Stewart, and two guests this morning from New York Presbyterian Hudson Valley Hospital. So thank you both, Ms. Angela Gonzalez Perez, for joining us, and Mr. Craig Hammonds for joining us as well. Good morning, and it's great to see you both here.
Good morning. Good morning.
All right, great. So a lot of, as many of you already know, this year has been a very challenging year. There's been a lot going on with, especially with the pandemic and COVID-19 and how it's had an impact on our entire world. But we wanted to kind of focus on some of the things that people can look forward to in the city of Peekskill. You know, a lot of people have a lot of questions about testing, where to go for testing. You know, and how they should be able to keep themselves from catching the virus, and if they catch the virus, what they should do. And you guys being in the building with the experts and those who are on the front lines can definitely give us a little bit more insight. So we hopefully today can be an educational conversation for those at home watching and learning, and just curious of what the next steps are, especially knowing that the numbers have increased over the last couple of weeks. So we'll start off. I'll start off by asking you guys, and either one of you can answer. You know, as far as the testing goes at New York Presbyterian Hospital, how can people go about testing? Is it for everyone, or is it certain staff, or how does it go? How can people go about testing up there?
So I'm happy to take that one. So I'm Dr. Craig Hammonds. I'm the Chief of Medicine at Hudson Valley Hospital. I'm also the Medical Director for the Outpatient Medical Group. We do have COVID testing available for both hospital staff, patients, and the community. Our testing site is actually located on the premises of the hospital in the tent that we set up in March and April at the beginning of the pandemic. Our testing is accessed through the doctors in the local community. We do that so that we do ensure that in ordering the test that there is someone who's going to make sure to follow up on the test and follow up with the patient to give them the appropriate guidance as to what to do with those test results. Our testing turnaround time is usually within about 24 hours, and we've been very good about getting back to people within that 24-hour time frame with both a positive and or a negative test result for the COVID swab, which looks for active infection, and the guidance as to what to do and not to do with that information in terms of protecting yourself, quarantine, and protecting your families.
So can I ask a follow-up on that, Dr. Hammonds?
Yes.
Just to be clear, so we recently just did a little inventory of testing sites in and around Peekskill. They include the CVS, it's got a drive-through on Welcher Avenue. Sun River Healthcare is a walk-up, and they have a sliding scale and so on related to insurance. The Anthony Wayne State Park across the river, you know, I've been to that one myself. You sign up online and you just drive through. It worked very conveniently for me when I was there. Caremount Medical in Cortland, appointments required in the Westminster Medical Center in Valhalla. And the city is currently working with WMC on positioning a kind of a mobile testing truck. And so we're working on that. Hopefully that would be a weekly event. And we welcome anybody who's a legitimate medical provider in offering services to city residents. And if the city can be helpful in some way, you know, we would like to be. But the question I have for you is, I guess we should be listing you on this sheet of paper, and you're not there right now. How is your service different from these others? Like, how should we be communicating this to the public?
So I think the most—
You want certain kinds of people to have their hospital refer them to your test versus others should be taken care of in a different way?
I think that the general medical community, ourselves and the providers, the other providers you mentioned, are all sort of working in collaboration to provide as many tests to the local and Westchester communities as possible. Even within our group, we've instructed our providers that to utilize all resources, whether it be New York Presbyterian resources, whether it be Caremount resources, whether it be the testing at Westchester Medical Center. The most important thing is that different than where we were in March. Anybody who wants, needs, or feels the need to obtain a test can obtain a test. And that can be done through New York Presbyterian locally at Hudson Valley Hospital. We can act as a resource as well to give other testing centers. Some of the testing centers like Westchester are drive-ups for family testing through cars. Depending on the comfort level of different individuals in the community. Our tent requires walking through the hospital lobby. Some people feel more comfortable staying in their car. We are aware of, and we should be listed absolutely on the community testing sites, but anywhere that somebody can get a test, it's important for them to reach out, and we are happy to help to determine where to go for different patients. The other thing that's important is we do emphasize that certain tests are more validated than others. At Hudson Valley, we are using what's called the PCR, which is a PCR swab. It's not a rapid test because we do feel more confident in the results that are provided from that test. There are certain school districts, for example, that in order for a student to come back, they're requesting or requiring that the test be that test versus a rapid test. So with so many tests out there, it's important to know what tests are being done. But I think the take home is with all of the care providers around, there is enough testing for anybody who feels they need to be or wants a test to get tested for COVID-19.
Absolutely.
I'm really thankful you said that. A lot of the the narrative has been that people haven't really found a place to find testing. And when I looked at the list that one of our council members put together the other day, and there's a lot of areas and places where people can get testing. And I think that hearing it from you especially will certainly hopefully give the people the facts, the truth. And that's another aspect of this entire process. Is there's a lot of misinformation out there. So when you hear that there's nowhere to get tested, you believe there's nowhere to get tested. But when you actually look for somewhere to get tested, you realize there are actually a lot of locations in the area where you can actually get tested. So the other question I had, just to follow up to that, is what is the turnaround time? Because that was something that came up in a discussion last night. People get tested and they're being told that, or at least they're telling us that they've been placed to get tested, and the turnaround was like a week and a half or 8 days or something like that. So what is the turnaround time on average to get your results?
So our turnaround time is really within about 24 hours. In patients coming to the ER, getting tested within the ER, actually those tests are staying local, and the turnaround time on that is 45 minutes.
Wow.
For our outpatient location, where we're going through the tent, our testing is going actually down to our Columbia campus just to be able to deal with the high volume of testing. And those are usually back within 24 hours. I think the key to the community is to let them know wherever you do get tested, the turnaround times may vary, but follow up with the provider. And that's one of the important things, that who's ordering your test. If it's through an urgent care, call within 24 to 48 hours. Follow up with your provider or whoever ordered the test to say, hey, is mine back yet? Because these tests in a lot of different facilities aren't being tested locally. Some of them are being sent off. Some of them are sent off to private labs such as Quest and LabCorp. Some are within the medical system such as Caremount themselves and other medical groups. Don't just sit back and wait. You might wait a week for a test that actually resulted 24 or 48 hours later.
Yeah, and I just wanted to clarify what Dr. Hammond said about our emergency room. So the emergency room is testing patients who have symptoms. So if you are sick and you come to the emergency room, we will test you and make sure that you don't have COVID. So we know how to treat you and to treat, is it COVID related or is it something else? So it's not just a walk-in for the ED to get tested. You have to be symptomatic. And the turnaround time is 45 minutes because it allows us to quickly take care of the problem.
Wow. That's
We also have a website, our nyp.org/Hudson Valley has different sites with coronavirus frequently asked questions. We also have an NYP coronavirus webpage link through that. And those links have other links to Department of Health CDC guidance, as well as testing sites within the Westchester community.
okay. That's great. So with the website, I know that there's some locations where people can actually set up an appointment And when they get to the actual location, they come outside and they do the testing right outside. And there's like an app. So as far as the follow-up goes to get the results, do they have to call the hospital, or is there like an app where they can download and get the information within 24 hours or 48 hours, or how do they get the results when they go testing up there?
When patients are tested through our site, we take it on as our responsibility to convey those results to the patient. So because there are multiple different electronic systems where those results may come from, they may be on the Columbia site down in the city. That's why we have a physician tied to, or a provider tied to every order. And it's that provider's responsibility to make sure that those tests are followed up and the information relayed to the patient they ordered a test on. So if I order your test within 24 to 48 hours, it comes back to me. It's my responsibility to make sure I provide that information to you. And that's the way we've set up our testing center.
Yeah, it can't get much better than that. And like Andy was saying something.
I appreciate the information on that, and actually we'll follow up to make sure we have and are able to distribute information related to your testing site. Wanted to ask a question about vaccinations, and I realize there's a lot of news right now, and there's in the sort of preliminary use of vaccinations is in preparation. What is your sense of how local people in Peekskill ultimately will access vaccinations? Will they be coming to the hospital? Will these testing sites be administering it? What do you think that's going to look like locally when vaccinations become available?
So I'll start there. So I don't think I introduced myself. I'm Angela Gonzalez Perez, the VP of Operations at NYP Hudson Valley. So as you all know, the CDC has initially sort of mandated the first round of vaccines to be given to frontline healthcare workers and those who work in long-term healthcare facilities. So we've been working internally to identify those employees who will be vaccinated first. So a lot of efforts have been really focused on making sure that we have the implementation efforts in place. Once we get the approval both from the FDA and the clearance from the Department of Health, we're working really closely with the governor's office on that. And that's going to be our immediate focus. Clearly, we are relying on our federal and state officials on the direction on patients and the community. So right now, that really hasn't been given to us yet. But clearly, once we get that the when and how, we'll make sure to, get those details in place. But currently, our focus is for employees.
So you don't have a sense of, at some point, people are going to need to get vaccinated, and broadly speaking, they're not NYP employees. Right now, you can't say exactly whether your hospital will be providing that service to others, or
again, I'm sure, Andy, I'm sure you'll appreciate all the nuance behind that. Again, this is happening so fast, and I think that we have to rely on our federal and government officials to give us some direction.
Right.
Which patients, for instance, what population is going to get it first. There's a lot of detail that we're waiting for. So I think that it's probably best to wait for that. And then we will be, happy to, give the Peekskill area some information on what happens next.
Absolutely.
Yeah, no, I think we should plan for that discussion, because at some point, a lot of people are going to have a question about,
Absolutely.
Do I qualify?
Exactly.
If someone mentioned to me, like, for example, if you might have a homebound senior who lives with you in a multi-generational household. And so if they're at higher risk and they're sort of on the list for vaccination, are their family caregivers kind of included in that? Like, I think that'll come up so there'll be all these questions.
Right.
We need to be sort of ready to try to refer people. And I look forward to, as we all find out more about how that distribution works, being closely connected and communicating about that. Obviously,
Andy, to that initial group that's being directed by the CDC and Department of Health will include are local nursing home residents
Right.
who are at highest risk. So in addition to frontline workers in that first delivery, we're supposed to include not only nursing home staff, but nursing home residents, and we'll work with our nursing home partners in the area, as there are several, to work to vaccinate those groups as well. What we understand is that after the vaccines start to be distributed, and they're being distributed federally in proportion to the states, in proportion to population, and then they're being distributed initially through larger healthcare providers so that we could get those out to the communities. And what we're expected is that there will be sort of a routine, steady flow once things start. And we will follow the guidance of the CDC, the Department of Health in New York State, as to how we can help to vaccinate the groups that in order of priority are set forth. And when the general population is part of that, we will definitely work both through the hospital and through the medical groups to provide those vaccinations. As many of you know, certain vaccinations, such as the Pfizer vaccine, require extremely cold storage temperatures. So the hospital is acquiring those freezers actually to make sure that we can store that. Certain vaccinations will be easier for us to ultimately provide through our offices because, for example, the Moderna vaccine will be able to be stored in the routine storage freezers and refrigerators that we have in the offices. So these workflows are all being developed now, even earlier than the vaccine has emergency use authorization, so that the minute we have availability, and we understand that December 15th is supposed to be a big day, that we'll be able to be ready to distribute under those workflows under the guidance of the CDC and the DOH.
Yeah, so a lot of, to take to Dr. Hammonds' point, a lot of work that's happening. But again, as you can imagine, things are happening very, very quickly. So thankfully, we are working both locally and with our larger New York Presbyterian enterprise to make sure that our hospitals are ready. So, hopefully we'll be able to start, sharing information through the medical group and the hospital as to how, we start inoculating, those in the community.
Okay, great. I had a question. I just wanted to go back just a little bit because, one of the things that the county had mentioned to us is in the yellow zone, it's like the city of Peekskill is, and they want to make sure that the school staff and teachers and students, parents and everyone is actually, tested. So one of the questions that came up recently in the conversation we had was about the coverage, like healthcare and like insurance. Like, what is the average cost of a COVID test? I know some people are trying to get tested every couple of weeks, some every month, some even more frequent than that. But for those who out there who just want to know the price or the cost of a testing COVID test, like what was an average cost of that? And does certain insurances cover it at NYP?
I can speak to that. So when we order a COVID test through any of our offices, and we have had a lot of teachers, students going through either our pediatric groups or our internal medicine groups to obtain testing, we do order that and then put it through to insurance. And
Okay,
usually the cost to that depends on the patient's insurance and their copay schedule. That said, for those patients who don't have insurance, we do know that the Westchester Medical Center site offers testing at $75.
Okay. Definitely something that people wanted to know.
Yep.
Isn't there free testing available somewhere as well?
Many of the some locations, I believe the one over the river at exit 17, I believe they were free. I'd have to double check. Yeah.
That was my experience too. There was no exchange of insurance information or anything. I just scheduled it and went over there.
Yeah. Maybe they just liked you over there, Andy.
I don't trust my memory on these things sometimes because you filled out a thing online and they gave me a time to show up. But I'm pretty sure there was no cost or even insurance information exchange.
Yeah. So the governor had mentioned to us, to the public, that data has shown that a lot of the cases are coming, a lot of the new cases at least are coming from like private gatherings and social gatherings. So can you speak to that for the people out there who are just interested? A lot of people are anxious to like shut down restaurants and shut down schools and shut down everything that allows public access. And it's scary because you're shutting down places that are actually following safety protocols to keep people safe. And unfortunately, you can't shut down people's homes. So what advice do you give to people who are preparing themselves for the holidays and they're going to take the risk on Christmas Day and New Year's Eve and things like that?
Craig, you want to take that one?
Yeah. So interestingly, this is the same response we're giving to our employees, because some of the safest places, believe it or not, are those that have appropriate protocols in place. My kids are in school. Some of the safest places you can be right now are in school. Transmission rates within the schools where people are wearing appropriate masks and PPE and socially distancing, when we're doing the right things, our rates are incredibly, incredibly low. In our offices, in the hospital, where we're appropriately wearing PPE and following our protocols, that's not where we're having our problems. It's when we are outside of the school or outside of the office and we're home and we sort of get a little lax socially. Even when we have our employee exposures, that's where those exposures are coming from. So to answer your other question, Mr. Mayor, the most important thing that we can do is follow the appropriate guidelines in the community and understand that wearing a mask when you can or cannot socially distance, washing hands, maintaining your gatherings small, and really with the increase in numbers now, really encouraging people to keep their numbers to really their primary, households.
Yes.
We've seen an incredible surge after Thanksgiving, and a lot of the epidemiologists feel that we have not even seen necessarily the results of Thanksgiving. And we're just about to come on, another holiday season. So we really, really, we're urging the public to really help us, because what we're trying to do here at the hospital is make sure we preserve our ability to have room to treat everybody and anyone who needs treatment. And the way to do that is to keep people safe. If you don't get infected, you're not part of the problem. And you're not a strain on the resources of the community or the hospital. Masks work. The vaccines are safe and they will work. We are all ready and willing and able to step up and get our vaccines when we're ready. We should all be wearing our masks. And again, socially distanced or not, out in public, if you are outside your house, please wear a mask. There's been a lot of politics tied to a lot of this, but the science is true and steadfast. Masks work. NYP system for both within our hospital and our patients have gone through incredible ordeals to make sure that we have the PPE necessary. In March, things were not the same. We were dealing with the new pandemic and we didn't have all the PPE we need. That's not the case now. If you come into the hospital as a patient, you will have a mask provided if you don't have one. If you are a healthcare worker, we have all the PPE and all the reserves that we need, thanks to Angela's team, and large supplies of it. So we're not in a position where we have to worry about the availability of PPE. And if there's anything that's going to keep us safe until the vaccines and all of the treatments help us get through this, it's wearing masks.
Beautiful. Thanks for that answer. I'm hoping that the people at home who are watching can hear that, because a lot of things that you said today will hopefully change the narrative. Because again, there's so many opinions that are being shared and posted, but it's always better to get the facts. And being in both of your experience, hearing it from you, it just enhances that a little bit more. So I'm hoping that people who are watching really are paying attention.
I wanted to. We have people on Facebook who are asking questions, and I've replied to a couple of them, posting information about testing sites and things like that. I wanted to read one question to you and see if you have a comment on it. It comes from someone named Jean Panzenko, and the person asks, they would like to see a more detailed analysis of where the COVID cases are originating from. Are there certain neighborhoods that are more at risk? What are the demographics? People who've been following mask and social distancing, or people who have not. And it's sort of a question, and I think there's a connecting question, which I just wanted. I know, and I can't remember who I was talking with recently. I think it was someone from the county health department. And basically, when they do the contact tracing, most times when they call people to do contact tracing, they can't get a hold of them, they don't end up completing an interview because they can't get people to pick up the phone or respond, much less take it to the next level and talk to the people that COVID positive person may have had interactions with. And so I'm just wondering if you have a comment about how that, what have you seen relative to which, if there are demographics or communities that are most impacted, and also if you have a comment about the contact tracing process. I wish more people would pick up the phone and agree to be interviewed, because I think that's actually what tells you more about how these virus transmissions occur. What would you say to that question about kind of where the transmission is most occurring, and is there anything we could do about the sort of the completion rate for contact tracing?
I think, it's a little bit of both. I think, very similar to what Dr. Hammonds was saying, is really controlling who you're around and keeping, very small group gatherings, because you're going to know who you're going to be with. So that really facilitates contact tracing, knowing who you're with, and making sure you have a way of contacting them. But clearly that's harder, right? If, folks are still shopping and having dinner, and things of that sort. So I think that it's important that, everyone takes that responsibility of filling out complete name and phone number and address when, you do go to establishments. Otherwise, we're going to have to probably get some more extreme measures. But, I think it's a combination of keeping things small and making sure that you provide the adequate information so that we can contact trace you. In terms of demographics, I guess we could speak to what we're seeing in the hospital and in the medical group. Primarily, we are seeing older, patients that are coming in who are the sickest, who are unfortunately have to get admitted. We are seeing folks that, are testing positive, but are well enough to go back home and are asked to take precautions at home, but they're not sick enough to be admitted. But for the most part, those that are ultimately admitted are older, patients that will have to, stay here. But, the good news is that this time around, we're seeing a lower mortality rate. So, patients are thankfully not dying, and they're staying less in the hospital. So it's a different kind of experience, but we are seeing, an increase here in the hospital for admissions. Dr. Hammond?
Yeah, and to piggyback on two comments that Angela mentioned, first with regard to contact tracing. Contact tracing only works if the community is on board. So in an environment where a lot of us don't like to pick up our phones if we don't see the name, one of the things for the community to know is a contact tracer calling you will be identified on the caller ID, usually as either New York State contact tracing program or something on the order of Department of Health. So what we have to do is implore the community to pick up that phone. This is not somebody invading your privacy. My son was quarantined because of a school exposure. We got that phone call. It only works if we all pick it up, answer the questions, provide good feedback, and then follow the directives that are given. The quarantine times are changing. They're being shortened once that's adopted by the Department of Health as per the CDC guidelines. So that should get easier as well. But what I would emphasize to the community is not to fear those phone calls. They're in all of our best interests, and to please cooperate with them and give the information necessary. And then to really emphasize, because everybody deserves a little piece of good news, to emphasize what Angela said, we're in a very different state, in a good way, in the hospital compared to where we were in March and April. This was a very, very difficult place to be in March and April. We saw a lot of people dying. And as Angela mentioned, the patients who are coming in, although sicker, are really much more stable than we are seeing compared to March and April. And we really didn't have much at our disposal to help people very well in March and April. But we know certain therapeutics that we did in March and April that didn't work, that we're not doing now. We know which therapeutics actually do work. And although there's no cure to this disease, there are a lot of treatments at our disposal. For those patients who qualify and get high dose steroids, that makes a big impact. Some are getting blood thinners, and we know that that's helping. And some are getting sort of treatments such as one that people have heard of called remdesivir. And in the appropriate patients, this is making a really big difference in the ability to stabilize patients. And actually, our discharge length of stay for our COVID patients right now is similar to that of our non-COVID patients, which is a remarkable feat compared to where we were in March.
Absolutely, yeah. And you said blood thinner was working as a
we
treatment
know
for
that
some?
one of the things that we learned in March and April is that this virus came along with a lot of clotting. It caused patients to have clots in blood vessels, and that was part of the deterioration or what resulted in some of the decline in people's status. So in appropriate patients, we know that if we put them on blood thinners, that keeps a lot of that clotting from happening. And that has helped us to keep a lot more people safe.
Wow.
Can I put another question to you that we're getting on Facebook? It's a good question, and I know we need to wrap up soon too. It's not an easy question, but the question is from Courtney Williams. Are there options for people who need to quarantine to do so away from their families? She says, like a hotel room or something, many of us don't have the space to be able to quarantine effectively. Do you know if there's any policy or program or support of this type that might be available?
Like meaning like is she asking like if the hotel pays for, if the hospital pays for a hotel for family members who may have been infected?
Right. I mean, she's asking if she's told to quarantine and she maybe shares a bedroom in a small apartment with someone, it cannot do it effectively in her own space. And this is just a hypothetical she's asking about. Is there any, do you know of any organizations that are providing some sort of support related to that to obtain a
So I can't
isolation?
speak directly to whether or not any organizations or the state, I'm just not knowledgeable enough on it, is actually providing alternative places for people to go to quarantine. I can tell you that that discussion is one that the contact tracers have with you when they call your house. And one of the things that both we as the healthcare providers and the contact tracers will provide is the best information that we have to tell you how to be safe within your home with the other individuals in your home. And I know because, again, as I said, I had that conversation with them. Absolutely understand that, everybody lives in different, degrees of, spaciousness and things like that. But the most important thing, if you are quarantining, is to try to, one, follow the same guidelines. You should be masked, as should anybody in the household. If there is an isolated bedroom, that should be the one where that individual spends most of the time and should eat separately from the rest of the household, and to limit the interaction as much as possible. And those sometimes may be the best options that we have available. And then to also make sure that other individuals aren't coming in. I can't tell you in sort of providing telehealth services to people with COVID, how many times I've heard somebody in the background and I asked who is there, and it was somebody who was not infected, who was not appropriately masked. When I asked, is that person wearing a mask? So the most important thing to know is, as much as we want to care for our loved ones, we can, but call your healthcare provider and say, hey, so-and-so in my house is COVID positive. How do I continue to care for them in the safest way possible? And we'll provide you all the guidance that we use to protect ourselves and our staff as we're taking care of COVID patients. And even if that means we'll give you a mask, when you come in, we'll give you an N95 if we have it. We'll do everything we can to help you take care of yourselves and your families.
Good. So I have, thanks Andy for that. If there's any more, let me know. I just have one or two last questions. As far as like the testing goes, is it necessary in your opinion to get tested frequently, or if you think you feel symptoms, or if you've been around somebody, or is it just a good idea to continue to get tested? What would you say on that?
So testing is key. Okay, if you are at all concerned about a contact exposure, If you're at all concerned about symptoms, then get tested. One of the strains that we saw coming into our testing capabilities coming into Thanksgiving were, and this is something important for the community to understand, I want to get tested so that I have a negative test 3 days before a holiday so that I can safely be with my family. One of the things we really want to emphasize to the community is, you know, if Thanksgiving's on a Thursday and you got tested on a Monday and you were negative, that doesn't mean you weren't exposed and didn't contract the virus on Tuesday and Wednesday. So it's important not to have a false sense of security and to sort of utilize that. So even if you have a negative test, and even once somebody's vaccinated, you've got a mask. And until we're all out of the woods and we're all in a position where we're not wearing masks and socially distanced, whether or not you've had COVID, whether or not you've had a vaccine, whether or not you've had a negative test, you've got to wear masks, socially distance, and wash hands.
Okay. Thank you so much. Andy, do you have any more you want to share or want to ask?
No, I mean, we're getting just positive comments and an appreciation for both of you for your comments, the clarity of your comments, and so on. And so we thank you for that. And I know we've gone on about 35 or 40 minutes, so we should probably wrap up.
Yes.
We have had approximately 20 to 30 people participating directly in this. It will be available for others to click on and watch, which I think is a service, and we very much appreciate that.
We appreciate the opportunity to join you both. This was great.
Absolutely. Please send our love and appreciation to all of the staff that is working over there on the front lines day to day. We appreciate you, and God bless you both. Continue to be safe and healthy, and we'll try to follow your lead over here on our side.
Happy holidays, everyone. Thank you.
And to folks who may be participating on Facebook Live or looking at this later, just be aware that the mayor and I, do this Facebook Live event every week on Tuesday at 11. We invited guests. We had the police chief recently. We're going to go get some more emergency responders in, and sometimes we just do updates on topics that the city council is focused on or the community wants. So it's just a weekly update. It's among the various ways in which the city communicates. We obviously have web pages on a lot of different topics. There's a COVID-19 tab. We are not your best source of up-to-date information on any health-related issue, but we try to distribute information as it becomes available, and on the city's Facebook page as well. So anything we can do to be supportive, we try to do.
And
right, so
Mayor, if I could sort of say one more thing to the community.
Please.
One thing we really want to emphasize, it's really important for you to continue your routine care. COVID's only one illness out there. One thing we were concerned about in March and April was that people were suffering from a lot of things other than COVID. Our ORs are open. Our medical group offices are open. You need to get your flu shot because that exists this year as well. And whatever your routine medical conditions are, please know that we've created a safe environment for you to come in and take care of that. What we don't want is people suffering at home, too scared to come out. We will see you in person. We will see you over telehealth. We will see you over telephone. In any way that we can make sure that you're all having your routine care as well, so that we can keep you safe and healthy.
Absolutely. We are open. Yeah. Get your mammos, get your
everything, right? I do want to highlight one thing that Dr. Craig said earlier. In the governor's speech a couple of days back, he had mentioned no more than 10 people in the household. And you said what we've been trying to convey to the community too. If you don't need 10 people, don't even do 10 people. Like there's a message behind that, but the number is not necessarily literal. If the governor says no more than 8 people, that doesn't mean bring 7 other people to your house. If you can keep it to 2 or 3 people, keep it to 2 or 3 people. The less amount of people that you have, the less possible the virus spreads. So I really appreciate the message you guys gave to the community today. Thank you so much. And the city is looking to help out in any way we can. So please send our love and appreciation and support to the team and staff.
Thank you. And thank
Absolutely. And for everyone watching, I'll let Andy close it off today because I usually close it off. And Andy, you can take us out.
We're done. Thank you. Thank you. See you next week.